Good morning. We are back out on location this morning with one of our favorite doctors of the blend. We're here with Dr. Mackay, vein and circulation specialist. Good morning. Good to see you again.
Thanks for coming to see us.
We're at your St. Pete locations, 3 locations here in the Bay Area, where we're once again talking about varicose veins. And let's kind of remind everybody what varicose veins are, the symptoms that people might experience with them as well.
Varicose veins are veins that are bulging out of the leg because they're under pressure, because somewhere the valves have failed and blood's flowing the wrong direction, and it causes pressure to build and makes legs swell and become painful and uncomfortable.
So let's talk about treatment now, because the good news is there is treatment to help with this. There are a number of different treatments. The one that we're going to talk about today, though, is probably, would you say, the most common?
Yes, it's the most common treatment. There's 2 competing things: endovenous laser ablation and endovenous radiofrequency ablation. Those are the 2 competing thermal ablations. They've been around, both been around a long time. Both of them are very accepted by the insurance companies and are just commonly performed, and they both work very well. I like the radiofrequency ablation. Seems to have a little less pain post-operatively,
okay.
But they both work well and do very well.
So explain what the procedure is. We had a chance to watch you in action today, so explain the procedure.
Well, there's a series of steps. First, you want to map out the vein that has the problem with it, and you only want to treat the one vein that's the problem. Mm-hmm. Then you get access to the vein, you put a catheter in, you numb up around the catheter in the vein, and once it's completely numb, you push a button and the catheter does the rest of the work. It heats up and collapses the vein as you gradually pull it back out.
How long does the procedure generally take?
It really sometimes as little as 15 or 20 minutes.
Yeah.
That kind of all depends on the anatomy and what exactly you're treating, but it's a fairly quick procedure.
We're here in your office where you're doing the procedure here, in and out essentially. Can you drive home? Does someone else need to drive you, or?
Generally, they do not. If they aren't nervous, so we don't give them anything to relax them.
Mm-hmm.
Most people don't seem to need anything. They drive themselves here, drive themselves home.
I think it's important you did mention it, but insurance does cover this if this is something you're needing done.
Yes, this treatment's been around for a while. It's sort of replaced what was the stripping done 20 years ago or so. Now these endovenous treatments have completely replaced that, and the insurance companies actually prefer them because they're less expensive. They're done in the office. They don't have to go to the hospital and have anesthesia like the old stripping was done.
Is this a pretty common issue? I mean, I'd imagine we're seeing your office busy today. I mean, are a lot of people having this done, needing to have this done? Yeah,
it probably affects roughly 20% of the population. It may be higher to some degree, but 20%, with bad enough symptoms that they really need to seek treatment.
How important is it that you do seek treatment?
Well, if you let it go too long, it can lead to that kind of damage to the skin that that is really not reversible. You can, at that point, you can still treat, but it doesn't really turn it around. It may slowly get better, but you want to avoid it. I mean, the venous ulcers, the stasis dermatitis, and we call it lipodermatosclerosis, where the skin is red, hard, and scaly, and even get sores on it. Once you fix it, you can stop the ulcers. It won't get worse, but boy, the damage has been done.
Well, what is your take home as we wrap up here? What do you think people should know? What's the best way to find out if you are a good candidate, doctor?
Well, if you see your physician, they can always ask them the questions and see if they think you're a candidate. Or if you have any questions, you can always make a consult. If you see varicose veins on your leg and you're having some discomfort in your leg, getting a consult would always be a good idea. And
again, 3 locations to do that, doctor. Thank you so much for having us out today. We look forward to speaking with you again soon.
Great.
For more info, head to our website as well, tbmorningblend.com.